launch this first-of-a-kind program in support of our veterans. You know, in Lee County, we have over 50,000 veterans living here. And it is just such an honor to be able to partner with the American Red Cross to provide them the services that they not only need but deserve. So we are just thrilled to be here to be a part of this. You know, Lee Health has been around for a long time. We've been serving the needs of this community for over 100 years, and we plan on doing it for the foreseeable future. And this is just another example of the compassion and the care that we show our patients every single day. And so it's with that that we want to launch this very special program for some very special people. So with that, it's really my honor to introduce the South Florida Regional President and CEO of the American Red Cross, Joanne Nowlin. Joanne.
Great, thank you. Thank you, Dr. Antonucci. This is a great turnout. Thank you all. Thank you for being here. And I want to start by thanking the veterans and their family members. And that's what brings us here today. The Red Cross has a rich history. In fact, we were founded on the battlefield by Clara Barton, who went to serve those who were fighting with courage and valor. And since that day, the Red Cross has always partnered with those who serve, our veterans and their family members. And so for us to be able to do this with our partner, Lee Health, that's how Red Cross gets anything done. It is with partners and volunteers. Lee Health is a perfect partner. They care about this community, they provide compassion, and it's a unique, one-of-a-kind program, which I am thrilled to be a part of, that we can help to support our veterans who have done so much for our great country. The Red Cross, I want to thank, I have some team members here, and the Executive Director for Florida Southern Gulf. Where is she? Jill Palmer. Thank you, Jill. And her partner in crime, who is our chairman of the board for Florida Southern Gulf, a dynamic woman, Jamie Anderson. Where's Jamie? Thank you for being here to celebrate one-of-a-kind program like this in our partnership. And I'd like to now bring up really the person who got this going, who had this innovative idea with some other folks, who was the director of our Service to Armed Forces. So please help me welcome Heidi O'Shea.
Thank you so much. So I want to start with a brief story. So the Red Cross has played this role with veterans for many, many years, but traditionally in either VA facilities or in military treatment facilities, military hospitals. So it's a role we're familiar with, but this is our first time doing it with a civilian hospital. Woohoo! So last year around the holidays, we did a holiday event for veterans at one of the VA facilities, and we just bundle up 5 greeting cards, and we dress up, and it's kind of a happy, fun event, and we go around and visit and give out the cards. Well, we knocked on the one door, and the veteran said, come in. It was an elderly gentleman laying in the bed, and I might have been wearing a hat with elf ears. It's possible. We said, hi, we're here with the American Red Cross, and we just want to thank you for your service and wish you a happy holidays, and handed him 5 cards. He burst into tears. Then his wife burst into tears. And then I burst into tears. It was such a touching moment. And he said afterwards, I can't remember the last time somebody thanked me for my service. He was a World War II veteran, and we had a great chat after that. But that's really why we're here, and that was the passion of Clara Barton that started the American Red Cross, was that we have an obligation to take care of our veterans, not only while they're serving, but throughout their lives. And you have a great VA clinic here in Fort Myers. They serve a lot of veterans, but I think we're realizing now that more and more veterans are as well being treated in civilian hospitals. So if we want to be serving the veteran community, we have to look outside our normal areas. So that's really what spurred this program. I want to recognize a few people. In the military, they have this tradition of coining people, and only commanders and senior enlisted people ever get coins to give out. And they're only given out for people that really go above and beyond and do something special. So in South Florida, in service to the Armed Forces, we've designed our own coin. And we've had it for over a year, and we've only given out 6. So you have to really do something special to serve the veterans of our community to get one of these. And I want to recognize first Dr. Alberti. From when the concept of this idea happened until us standing here today, and there was a lot of work in between with lawyers involved, so just that should tell you it got a little tricky at some points. And there were a few times I wasn't sure it was going to actually happen, but we had a meeting that I recall, and Dr. Alberti came in and said, I love this program, I love this partnership, I don't know what the disagreements are, but you need to work it out because this is going to happen. So thank you very much. Yep. The next person I want to recognize, who she keeps saying she didn't do anything, is Jerry Grimes. Thank you so much for all your help. So Jerry helped us get all of these wonderful volunteers on board. So they're ready to go really through her hard efforts, and always being the first facility to launch a new program. You're the one that gets all the bugs and all the how is this going to work, and you just did a fabulous job, and we really appreciate your help. And Joanne already mentioned, but Jill, so all of this started at lunch at Panera Bread. Jill said, look, if you want to do anything serving veterans in Fort Myers, you need to know Kim Gay. And so we had a great lunch, and we were all just brainstorming, throwing out ideas, and I happen to recall that this particular idea was Jill's. So thank you very much. And I'm almost done. The last person, definitely without this would never have happened. And I never met, I'm a veteran, I'm retired Army. I really never met another person that hadn't served personally that has such a passion and such a love for our military and our veterans, and just goes way above and beyond all the time. You're very lucky to have her in your community, in your hospital system, Kim Gay. Happy to be here. Very happy to have found a partner in Lee Health that shares our passion for serving veterans. We're glad to be here. You know, not everyone has that great support system and tons of friends and visitors. So we know at least they'll be getting some visits from our very special volunteers, and they'll be getting very important information as well. So if they ever have a need, either themselves or a fellow veteran down the road, we're going to be providing them with information about resources right in this community that can help them. And that's so important, and we're so happy to be here. Thank you.
So good morning, everyone.
Good morning.
I'm excited that we are here at Cape Coral Hospital, part of Lee Health, being the first hospital, hopefully the first hospital in the system, but the first hospital, like you've heard before, civilian hospital, starting this program, which is very, very close to my heart, the American Red Cross Veteran Visitation Program. So we at Cape Coral are known to be the pilot for almost everything that we do at Lee Health. So, and I'm proud of that, and that says a lot about our staff, says a lot about our leaders, and it says a lot about our community, because when we get focused in something, we get it done. And I'm so happy and blessed to have a great team that helped us bringing this to fruition. I'm a veteran, as some of you know, so this is very close to my heart because I will be one of these days someone in a hospital laying in a bed, and I want one of these great volunteers to come and visit me, because probably I'm gonna need some resources like our patients here. We are, again, excited that we can be the first here in our system, and I know that we're going to do a great job. We're going to work all the kinks out, and we're going to spread this throughout the county with all the other 3 adult hospitals doing this. I want to thank, from the bottom of my heart, the volunteers, because if it's not, if they don't participate in this, we don't have this program. So I want to really thank you. And this started when we, Nancy and I, my diet partner, we would round on Thursdays in an intentional rounding, and we would see a lot of veterans as our patients. So I want to thank Nancy, I want to thank Kim, I want to thank Joanne, Jill. When I was part of the Red Cross board, we talked, we met with our HR director and chief officer, and we started thinking how we're going to be able to do this between the volunteers of the Red Cross and the volunteers of Lee Health. So we were able to do this. So I also want to thank Mike. It was probably in his first week here at Lee Health that we asked him to meet with us, and we were successful, and we were able to do this. We are very honored to take care of the men and women who have served, and I know that this is going to be a great program for our community and our patients. So I just want to introduce again Kim so that she can say some parting words, and we're going to ask you to stay behind so that we can celebrate a little bit more.
So very much for coming to our celebration today. As they have stated, this is our first of pilot. I have been taking census. Census, for those that don't know, is every day I can go into our computer system and see how many veterans are logged into the system. Thanks to Carol Williams of our IT department. She was able to do the program for us. Earlier this week we had 60 veterans throughout the system that were inpatients, and so it has been very interesting. We started with 20 for the whole system, and now we're already up to 60. And I know that number is going to increase as the word gets out that 1, we care for our veterans, and 2, we're actually documenting it so that our wonderful volunteers can go and visit with them. So what we would like to do now is thank everyone for coming. I would like to thank my department, the Community Affairs Department, and my boss, Karen Krieger, for standing behind us and helping us, and also the volunteer directors at the other campuses to help us with the policies, the uniform. This uniform is made especially for these volunteers that we have the dual branding on, and thanks to Lisa and marketing for helping us make that happen. We have Susan Crow here from Gulf Coast, and we have Teresa Frank. Teresa, where are you? Teresa in the back. She is Lee Memorial and Health Park. So I told her this morning we're coming to a campus near her. So we are coming. We just don't know yet what speed, but we know eventually all 4 campuses we will be seeing the veterans and taking care of them, getting the information out. We do not want our veterans to fall through the cracks. And unfortunately, they do not know all the benefits that they are supposed to be getting, as well as the wonderful resources we have in this wonderful community. So without further ado, We have fruit and drinks on the back table with coffee. And then we would like to, any of the news crews that would like to, we're going to take a couple of our volunteers and we're going to go and visit 3 of our veterans that are awaiting our visit. So thank you again for everything.
Before we celebrate, I do want to give a very, very special welcome to a couple of folks. Therese Everly from our board is here. Thank you. And Mayor Joe Coviello.